Saya punya menstrual tak konsisten, and then bila datang dia heavy flow, and then I dah suspect there's something wrong. Dia ambil sampel, dia buat endoskopi, and ambil sampel I tu for cancer marker, and from there baru tahu yang I ada cancer.
Madam Azura, she's 49 years old. She came to see me because of heavy bleeding, and then after we obtained sampling, noted to have a cancer of endometrium. So since she has early stage of cancer of endometrium, so I've offered her to undergo robotic radical hysterectomy with bilateral saphengolectomy.
Masa tu mula I terkejut, sedih. Kita kalau boleh tak nak buat surgery. Kalau boleh I tak nak buang rahim. I nak cuba cara kampung lah apa semua. Tapi doktor cakap it's better ni sebab I punya tu dah terlalu besar. Dia kata it's better that I remove untuk jangan kanser tu merebak. Bila doktor bagi tahu pasal robotic surgery ni, saya bersyukur sangat. Saya happy sebab saya ada option lain selain daripada normal surgery. After restu dari suami dan adik-beradik, then I go for the surgery.
The benefit of robotic surgery related to gynae-onco procedures, especially for Madam Azura, because we need to do a radical hysterectomy with pelvic node dissections. So removal of the nodes along the vessel required a very good precisions of the robotic arm, because when we sweep the lymph nodes along the vessel, we need some stable hand, which the robotic arm offered a good stabilizations of the equipment, and then it doesn't create any tremors. And the complexity of this surgery required robotic arm is simply because the magnifications of the camera can go up to 10 times, and then the precisions of the camera movement and as well as the equipment movement has actually reduced risk of blood loss, bleeding, nerve injury, reduce the risk of infection and blood transfusion. Majority of our patients, if we do these procedures, they can be discharged even in day one for normal hysterectomy. But for patients who require lymph node dissections, where you have to monitor the patient a little bit longer, so basically on day 2 post-op, we can actually discharge the patients. She's happy with the surgery because she's recovered very fast, and she was very mobilizing in terms of eating well after surgery, and we also removed her catheter to pass urine immediately the next day. We can discharge her on second day post-operations. Those who require a complex surgery, even gynecological malignancy or even endometriosis, I think robotic surgery would be given you a good outcomes with regards to less complications, especially for those patients who require to be up and go. Robotic surgery will be able to actually give you a good comfort, in particular less complications and less pain.
It's a long hour surgery dengan Dr. Andi, tapi yang penting lepas surgery tu kita tak rasa sakit yang sangat sakit, less pain, kita pun recovery cepat. It's a advantage to us lah kalau buat robotic surgery.